This place is like somebody's memory of a town, and the memory's fading.
You get any sleep last night?
I don't sleep. I just dream.
In 1957, the CIA begins funding the work of Canadian psychiatrist Dr. Ewan Cameron after reading about his new and radical brand of psychotherapy.
You would basically put somebody to sleep with drugs for many, many, many days, give them massive doses of electric shock therapy, literally hundreds of times the normal dosage, and basically you would reduce the person literally to a vegetable. And the idea clinically was you would wipe out either delusions or depression or psychiatric symptoms, and then when the person came back to their normal self, which would take months and months and months, the psychiatric symptoms would be gone.
This kind of clinically induced amnesia is of special interest to the CIA. Dr. Cameron agrees to take his treatment one step further. In addition to de-patterning his client, he would attempt to re-pattern in new thoughts and behaviors.
The CIA funded this experiment because if you could take a person who was an enemy agent, erase that personality and put in a new personality, you have a convert.
At the CIA's instigation, Cameron devises a three-step brainwashing experiment.
The three parts consisted of, first, what he called de-patterning, which was the use of LSD and intensive electroshocks. So that's phase one, is wiping the slate clean. Second was trying to program in new patterns of behavior by playing tape-recorded messages hundreds and hundreds of thousands of times. The final phase was a 2 to 3 week period where Cameron would put patients to sleep using barbiturates to try to suppress any recollection of what had been done to them.
By far, the most chilling experiments we have uncovered took place at this Gothic estate called Ravens Crag, halfway up Mount Royal in Montreal. It houses the Allen Memorial Institute of Psychiatry of McGill University. It was here that the CIA funded a series of experiments, severe experiments. The work was done by the Institute's then director, Dr. Ewan Cameron. It is the closest experimentation to brainwashing yet disclosed. His work, unprecedented in psychiatry, consisted of three areas which he called sleep therapy, psychic driving, and the ultimate de-patterning. Dr. Maurice Dongier, current head of the Allen Memorial Institute.
In his psychic driving, so-called type of therapy, he would give the patient intensive electric treatment in order to make the patient regress deeply, become forgetful, and then he would attempt to implant new ideas in the mind of the patient.
Now, to a layman, it would appear that Dr. Cameron was trying to take the slate and wipe it clean, the slate being the mind. In other words, brainwashing.
Exactly, that's a very good comparison.
Brainwashing.
Yes, to life.
Val Orlico of Winnipeg, Canada, the wife of a member of the Canadian Parliament, was a patient of Dr. Cameron's. She entered the Allen Memorial Institute because of severe depression. She describes for the first time publicly the LSD therapy and psychic driving treatment that she was given by Dr. Cameron.
And then the drug began to take hold very rapidly because it was an IV injection, and things became very furry and very frightening, and had a lot of sensations that it's very difficult to recall. Nobody explained it to me. Nobody ever asked me if I was willing to do it or anything.
He had this feeling that he would be able to get through the resistance of illness and to reach deep changes very quickly.
Did he?
I don't think that when you look at that in retrospect, the hopes that he have been in any way fulfilled.
The most severe technique Cameron used was de-patterning. He described it as breaking up the existing patterns of behavior by means of intensive electroshock therapy with prolonged periods of sleep. He carried out these experiments in something he called the sleep rooms.
People in there were like babies. They cried and they were very disoriented. And we were very afraid of the sleep room. We used to walk very carefully against the side of the corridor that was opposite the sleep room with our backs to the wall when we'd go by.
Cameron used this combined sleep electroshock treatment on patients as long as 30 days. One patient he kept asleep for 65 days. Cameron retired, and his successor, Dr. Robert Cleghorn, ordered a follow-up study on the patients treated with Cameron's de-patterning method.
It showed that it was no more beneficial in its result than the use of more conservative methods.
But the follow-up study showed that 60% of those who had been de-patterned still had amnesia for periods of anywhere from 6 months to 10 years. That's quite a memory loss, isn't it?
That is a memory loss. Indeed it is. It's I think, more than desirable.
In retrospect, does Dr. Cameron's experimentation and his treatment appear harsh?
I would say yes. This forceful type of approach that I was describing to you is definitely, it can be said that it's harsh.
I wouldn't call it harsh. I would say it was harder on the staff than it was on the patient.
What?
It's because these people had to be fed and they had to be cared for and they had to be given sufficient fluid and food and toileted and so on and so forth. It was a very difficult thing for the staff to follow these patients properly and see that they did well.
Bro, what are you talking about, man?
Well, I'm glad he was concerned for the staff. But damn it all, I wouldn't. I could have maybe had